I want this meeting to be easy going. I want you to ask questions, and if I don't have the answer, I'll do my best to get it for you, and we can send it back out through email. But my goals today are simple. We want to understand the history of the plan here at Henderson State University, review what healthcare reform has to offer and its impact to the plan, what we're seeing with healthcare trends in the form of both on the medical side and on the pharmaceutical side, understand what the changes are for 2016 because that impacts you, right? That's your plan. You need to know how that's going to roll. And then we're going to highlight some other enhancements that are being provided to you, such as being able to buy additional life insurance coverage on yourself, your spouse, and your children if you so choose to. But our main goal today is to make sure you're informed about the benefits that are being offered at Henderson State University and what the changes are for 2016. So, without much more ado, we'll see what we can do here. The agenda for today is simple. Let's go over what's happened, how we got to where we're at, talk about what we're going to do going forward, and I'm going to throw some insurance terms at you today. You've heard probably of your grandfather. Well, the federal government uses the grandfathered as a term that's used to describe a health plan that was in place prior to March 23rd, 2010. Guess what? Your plan was in place prior to March 23rd, 2010, so it's a grandfathered plan. And we've maintained that status as long as we can. Moving forward, we're going to be a non-grandfathered plan. So write that down. You'll probably remember and go, non-grandfathered. I learned some new terms today. So I'm going to throw a bunch of acronyms at you. If you're not sure what they are, please ask me and I'll be glad to answer anything I may help you understand better. Healthcare reform. It was passed March 23rd, 2010. We had a lot of information on the TV about it. It went to the Supreme Court, and the Supreme Court says, hey, it stands. It's the law of the land. It was a 907-page bill, had thousands of rules and regulations that we're still interpreting. It was $938 billion that was devoted to this over the next 10 years for the expansion of coverage. And it will help people have access to health care. The number here was 15 million, but actually we were looking more towards 32 million that would receive either a subsidy and be able to purchase private insurance for the first time. It was probably one of the most significant domestic legislations passed since 1935, which was the Social Security Act. It does have impact on every American, including you, and it will make substantial changes to the insurance marketplace, and it has impact on your plan this year for the first time. You may have heard this on the news, you may have read it in a newspaper, but this legislation will have impact on HSU's plan this year. It's been kind of like changing 4 tires on a moving vehicle. I've been working with it since March of 2010, and I can tell you it's very encompassing. Your Department of Human Resources has been apprised of the situation and of the law, and your Benefits Committee, they got a little dose of it this year for the first time. So we're all learning together. Bear with us. There are a lot of changes, and it will have some impact on your plan this year. Some of those changes involve, guess what? Not death, but just taxes. Okay? There are a lot of new taxes and fees that are associated with the ACA. Those taxes and fees help fund many of the changes that are mandated by the healthcare law and also help with the subsidies that are going to be provided to folks to have access to insurance. There are also some new benefits and coverage requirements that the law imposes. So HSU has remained a grandfathered plan, and we've not had to pick up some of those benefits. The committee felt like it was best at the time to stay grandfathered as long as we could. Going forward, because of some cost implications, budgets, and things of this nature, we're going to lose that status, and we're going to have to pick up some of these mandated benefits and coverages. That is good to the member. It will prove costly to the plan long term, but there's nothing we can do about it because it's the law, okay? And then in Arkansas, y'all are probably familiar with Medicaid expansion. We have over 220,000 people that got access to insurance this past year under the Medicaid expansion in the state of Arkansas. I'm not going to spend a lot of time on the taxes and fees, but I wanted you to know that there are some taxes and fees. It does have impact. It impacts our premiums. It's just like everything else. You pass it on to whom? The end user or the consumer, okay? It's no different than buying a cheeseburger at McDonald's. If the tax is $1.08, you got to pay it to get the cheeseburger, okay? They're passing it on. It comes in the form of several different features, whether it's a health insurer fee, the Patient-Centered Outcome Research Institute fee, transitional reinsurance fees, and then the last one is the one we're all worried about. It does not take effect until 2018, but it's the excess tax on high-cost plans, or what we're calling the Cadillac tax. This one is still being debated in Congress. There is hope that this one will be squashed. I am not a representative of Congress. However, you have a vote. You have a voice. Contact your congressman and talk to them about this tax because it is deathly to all of the health care in the United States. It's a 40% excise tax that will be imposed in 2018 on plans. Okay, I've talked about grandfathering. There were some things we could do to stay grandfathered, and I'll say that HSU did a good job managing this. We did as long as we could go to stay grandfathered. The law says there's a couple things that will trigger some changes and cause you to lose the status. One is if you eliminate certain benefits. If you went from, take your co-insurance from 80 to 70%, that would cause you to lose the status. If you increased your deductible amounts more than by 15%, that would cause you to lose the status. If you changed your co-pays to doctors or to pharmacy by more than $5, that would cause you to lose the status. And then if HSU says, hey, we're not going to contribute the same amount that we were doing on March 23rd, 2010, and they can decrease it by 5%, that would cause us to lose the status. So they had us boxed in, pretty much. And we went as long as we could. The committee said, we got to ride this as long as we can. Offer an affordable plan, a comprehensive plan, and let's stay grandfathered. And that's what they did. This year, we were faced with some challenges. I want you to take a look at this. There's some numbers up here, and I hope you can see it. I'm a mover, and your video takes me. I'm sorry, I won't move. September 12th through August the 13th. Did anybody think that we paid claims over $2 million for this plan? We did. 2013 and 14, the paid claims went from 2.1 million to 2.2 million. This past year, it went up to 2.8 million. The premium that we had paid and collected on HSU's behalf was 2.6 million. So we exceeded the premium that was collected. We were faced with a rate increase. Your committee, which is comprised of members of HSU staff, Senate, and I assume faculty and other members, sat down and looked at the RFP. They had an RFP. They reviewed the submissions from different companies. We ended up looking at 70 different options for HSU for 2016 to see if we could find a plan that would fit your budget, HSU's budget, and make sure that we still offer a good comprehensive plan for the employees here at HSU. We were looking at about a 15% increase if we stayed grandfathered, but we also were faced with budget constraints. Everybody understands what that is, right? None of us are getting raises, but the tax keeps going up. I know that's the way it works in our organization as well. But when you look at where your health care dollar goes, this is kind of a breakdown of that $1 bill. 34 cents goes to hospital care. 28 cents goes to your physician. 14 cents to prescription drugs. And I can tell you that number is going to continue to grow. 6 cents to dental services. 6 cents to other medical services. And then you got to pay for your administration of your plan About 12 cents goes towards that. Speaking of pharmacy, let's talk a little bit about pharmacy. We've met with the committee and explained to them that we're seeing some increases on the pharmacy side. This is not just HSU's plan, this is across the United States. A couple things we see with drug trends are, number one, the number of prescriptions that are filled by our members. Most people use, the most benefit used under their health plan is pharmacy. They go to the doctor maybe once or twice, but they're going to get a fill in the pharmacy. If you look at the utilization, pharmacy is probably the number one thing that's used. Okay? The next thing is some of the drug mixes that we're seeing. There are a lot of new drugs that are coming out. They're not generic. They're specialty drugs, and they're very expensive. I've got a new drug for Hep C that cures Hep C. It's $150,000 for a 3-month regimen. A liver transplant runs anywhere from $135,000 to $150,000. If your body conforms to that transplant and everything goes well, that's a great deal and you save your life. The drug Hep C, you take it in a 3-month regimen, you don't have to go through a liver transplant, but it's about $150,000 as well. Okay? So the price is driving some of these drugs that we're seeing on the pharmaceutical side. There are new drugs that are coming out, and I'm sorry to tell you that there were 80 new specialty drugs that were launched in the past 4 years, and we've got about 100 more sitting in the pipeline. Now folks, these are good things. They help cure cancers, they treat infectious diseases, your autoimmunes, your heart, blood, and respiratory. These are good things, but they come with a cost. And we've got to maintain that balance with you on your health plan to where we keep it affordable, offer the coverage, and where everybody can, go home at the end of the day and turn off the lights and say, I can feed my family too. I'm not paying just for insurance. Okay? Here's my slide on the Hep C drug. You'll see there, and I want to make sure everybody understands, I wish this wasn't on here, but the compound drugs, we don't cover compound drugs in a fully insured environment. Your plan does not cover them as well. We're seeing a lot of this in the marketplace where the doctors are writing compound prescriptions. They're not FDA approved, and they're very expensive. But we do cover the Hep C drugs. We've got a new cholesterol drug that's coming out that will be higher than $150,000. Right now, you can take regular medicine, Crestor. Probably familiar with that, seeing the ads. That's still covered, but we've got some new biotech drugs that treat it where you don't have to take it all the time. It's convenience, okay? So what we're seeing is some double-digit trends on the pharmacy side, and what's driving this is our specialty drugs. As I said earlier, there were about 86 new drugs launched in 2014. We had 50 coming out in 2015, and we're expecting some more that are in the pipeline in 2016. So as you saw earlier, we were at a little over 2 million claims. We had to sit down and figure out what's best for HSU. As I mentioned earlier, we looked at 70 different plans. And this is where you want to wake up in the presentation, because I can tell you this is where it's going to impact you the most. When we lost the grandfather status, we're going to add some benefits. Those are good benefits, but they do come with a cost. And I want to make sure you understand what those benefits are. Under the health care law, you have to add preventative care and women's preventative services. It must be covered with no cost share. That means you don't pay a copay, you don't pay a deductible, you don't pay anything in coinsurance. It's paid for 100%. The biggest driver is the colonoscopy. Now, Chad, that's not a bad thing. Colonoscopy saves life. Yes, they do. They do. The average cost for a colonoscopy in 2015 was around $1,248. So if everybody in the plan runs and gets one, which I hope, everybody gets checked. I want them to be, have good wellness and make sure it's good. But if they do, you can see how much that would impact the plan just on that one benefit. On the women's preventative service package, the primary cost driver is the contraceptives and sterilization. There's no cost on that. It's free. The next one is the newest benefit, and this one has a lot of people concerned. So I want you to write down this acronym. It's called TRUE. The acronym stands for True Out-of-Pocket Expense. Okay? Currently, under your plan today, you have a deductible of $600. Everybody shake their head. You've got that one, I understand. And your out-of-pocket is $2,000 plus that deductible at $2,600. So if you had a catastrophic claim, anybody know how much a heart attack runs these days? Let's call it about $55,000 for a small heart attack. So if you had a small heart attack underneath your health care plan, today, at your current plan, you would be out, as long as you were using in-network doctors and hospitals, you'd be out $2,600. That's the top, okay? Moving forward to 2016, that's going to increase to $5,000, okay? So let's go back to that heart attack. I'd have the heart attack, the claim comes in, we take the discounts away, and it's still $55,000. I'm going to be out $5,000, and then all of the benefits are paid at 100% after that claim's been paid, and you're out $5,000 for the remainder of that calendar year. Currently, today, when you go to Walmart to fill your pharmacy, what do you pay? A copay, right? That copay does not count towards your out-of-pocket, does it, today? It never has. Your deductible doesn't count towards that out-of-pocket either, does it? Going forward, 2016, it will. Everything counts towards the out-of-pocket. So every time you go to the doctor and they ask you for your copay, that'll count towards your out-of-pocket. Every time you get a prescription filled, that copay will count towards your out-of-pocket. Your deductible, out-of-pocket. Your co-insurance, the amount you pay out-of-pocket before everything gets paid 100%, counts towards that. So once you've hit it, the next time you go to Walmart to fill your prescription, you don't pay the copay anymore because benefits are paid at 100%. Does everybody understand the truth and how it works? Because it's very important. All right. The next thing that has to be covered are clinical trials. This is new to us. We've not covered clinical trials under our health insurance plans that are fully insured in the state of Arkansas. Under the federal government's new plan, clinical trials are covered. So if you're in an extensive trial at let's say at UAMS, and you're going through a trial for 6 months and you're inpatient, that's covered. It wasn't in the past, okay? So the increase in utilization, the increase we're going to see probably in claims cost, it's going to drive our premium down the road. And so we had to make sure that we take measures and work together to offer a plan that's affordable and one that's comprehensive in care and coverage for you guys, and that's kind of what the committee looked at when they reviewed all this. As I mentioned earlier, there were 70 options we looked at. I think some of the committee members that are here can tell you that they learned some new acronyms. And when the smoke all cleared, there were 2 goals that were set. And if I'm misspeaking, ma'am, I know you were on that committee, you let me know. But they wanted to be a good steward of HSU's money. They wanted to look after the employee and offer a plan that has good coverage and make sure that we could afford it. And then once the smoke did clear, they made a recommendation to the president. My understanding is he has made and given his approval for that. So here are the changes for 2016. The first change is on the deductible. We'll be moving from a $600 deductible to a $1,000 deductible. Now remember, you'll still have your copays to your primary care physician and to your specialist. When does the deductible come into play? When you're going inpatient, when you're having an outpatient procedure. But most of the time, when you're just generally accessing your doctor, you'll pay a copay. And guess what? Those copays count towards what now? Everybody's listening, I love it. Towards your TRUE. The next change is on the TRUE. We're moving from a $2,000 out-of-pocket to a $5,000. Okay? And again, the TRUE stands for True Out-of-Pocket Expense. The TRUE can be met by payments of co-insurance, your prescription drug co-payments, your doctor co-payments, deductibles for in-network provider services. I want to make sure everybody understands it cannot be met by non-covered expenses or any co-insurance or deductible amounts for out-of-network. Stay in network. Go to your network providers and hospitals. You'll get the best deal, the best discount, and you'll help the plan's utilization overall. The next improved benefit will be on the wellness. The wellness benefit will be at no deductible, no copay, and pays 100% for in-network wellness visits. Ladies, we want you to do your pap smears, your GYNs, and your mammograms. If we can find something early and find out what's going on early, we can make sure that you're around a lot longer. Gentlemen, don't run, go to the doctor. It's okay to get a physical. And if you're of age, a PSA exam. It also covers a bone density test, which we haven't really talked about. It does cover a bone density test underneath the new law. Again, the biggest driver is the colonoscopy. Not everybody wants to run down and get a colonoscopy, I understand. But please note that that is a life-saving exam and can find something early and keep you from having to face a bigger claim down the road. The last one is the drug card copay. As we mentioned earlier, we're seeing a huge trend increase on the pharmacy side. To get that $150,000 drug, yes, you're going to have to be some approvals be made, but for $65, that's a pretty good return on investment. I'm not getting that on my stocks. I don't know if you are, but if you are, I want to visit with you after the meeting. That's a pretty good deal. So our copays are going to go up just slightly. The generic stays the same. There's a $5 increase on the brand name and a $5 increase on the non-preferred brand. So we've got a couple of changes for 2016. Deductible, true, increased wellness coverage, and drug card copay change. Those are the changes for 2016. They become effective when? January 1st. Okay? Remember, you still have your physician copay, both to the primary care and to the specialist. This is just a quick overview, and I know it's hard to see, but I just want to make sure it has a typographical error right here where my mouse is, and I'm covering it. What is our deductible for 2016? What's it going to? $1,000. If you have a family plan, it'd be times 3. Just like it is today, 600 times 3. We'll keep that in place. The troop is going to be how much? $5,000. And then our pharmacy copay is increasing by $5 on the middle tier and the last tier. And then the wellness coverage. Do I pay a copay on my wellness now going forward? No. What applies to my troop? Pretty much everything in network. Anything you do in network, to a doctor, to your pharmacy, your co-insurance, your deductible, it accumulates towards that. So really and truly, you've been digging in your pocket, paying for some services that really hasn't counted towards anything. Going forward, it will. So let's say I'm on a third-tier drug, and it's $60-something a month, and I get that 12 months out of the year. That money's now applying towards my out-of-pocket. If I go to the doctor 4 times, and I have a $30 copay, so that's another $120 applying towards my out-of-pocket. Let's say I go on vacation and I hurt my knee, and I have to have knee surgery. So my deductible, all those copays, all those things that I do at the doctor will apply towards my out-of-pocket. Once that out-of-pocket's been met, it pays for how much? 100%. 100%, that's correct. For the remainder of the year, it starts over on January because we run January through December. Does that make sense? Okay, so now's the fun time. It's interaction. Questions about the changes or how we got there. I'm thankful for the committee for allowing me to come and do an informational meeting. I hope we've covered the things they wanted covered. We want you to know what your benefits are going forward. We wanted to communicate as quickly as we could. I mean, I think we literally got a decision from the president last night at 8:49, somewhere around that neighborhood. I think he's been out ill. But the committee did do a good job, and they represented you well. and I would encourage you to visit with them if you have questions or concerns. And I'll be happy to speak with you individually after the meeting if you have a health concern that you want to talk to me about. I'd rather do it in private because of the Health Insurance Portability Act and privacy laws and things of that nature.